The rabies virus is one of the scarier viruses that we know of today. It is an extremely deadly virus that is present in animal saliva and contracted by humans after a bite from a rabid animal. Remember, the rabies virus is a negative-stranded RNA virus that is bullet-shaped. After a bite leading to local inoculation, the virus binds to nicotinic acetylcholine receptors and travels via retrograde transport from the peripheral nervous system back to the central nervous system. In the central nervous system, the virus can infect Purkinje cells of the cerebellum as well as hippocampal neurons. When the virus infects these particular cells, the virus forms what are called Negri bodies, as we see in this image here. Negri bodies are cytoplasmic inclusions found in the cells infected by the virus. After initial infection, the incubation period may be weeks to months before symptom onset occurs. Clinically, patients infected with the virus initially have flu-like symptoms, including fever, malaise, anorexia, and fatigue, that eventually progress to more serious symptoms such as seizures, hydrophobia or fear of water, hypersalivation, as well as photophobia. Even more scary, the symptoms can progress and cause a fatal infection, which is paralysis that may lead to respiratory failure, coma, and even death. If someone is suspected of having been bitten by a rabid animal, post-exposure prophylaxis should be administered in the form of the killed rabies vaccine or the human rabies immunoglobulin should be administered. Rabies is one of the few infections where post-exposure vaccination can be used to prevent the person from actually manifesting the fatal encephalitis. Unfortunately, if the patient has established rabies, these precautions do not have much effect. The Ebola virus has been known about and scientifically studied for a long time now, but just recently has attracted the national spotlight with the outbreaks in Western Africa. The Ebola virus causes the Ebola virus disease, or more commonly known as Ebola. The Ebola virus is a filovirus, is a positive-stranded RNA virus that can infect many cells throughout the body, but the main targets include the endothelial cells, the phagocytic cells, as well as the hepatocytes. The virus initially infects monocytes, and after infection of the monocyte, it results in the release of TNF-alpha, IL-6, and IL-8. The cytokine release leads to a septic or a systemic inflammatory state. Later in the infection, the virus infects the endothelial cells, resulting in their instability, detachment, and cell death. This vascular damage and instability leads to hemorrhage as well as hypovolemic shock. Initially, patients infected with the virus develop what are flu-like symptoms, including high fevers and myalgias. They can also develop nausea, vomiting, and diarrhea. This is all caused by the release of the cytokines that we just mentioned. In severe cases, the infection can present as disseminated intravascular coagulation, followed by diffuse hemorrhage and shock as a result of the endothelial cell damage. The virus has a very high mortality rate and there is no treatment. Patients just require supportive care, especially in the form of IV fluids. Transmission of the virus requires direct contact with bodily fluids, and there is a high incidence of nosocomial infections. Strict isolation precautions must be adhered to in order to prevent transmission of the virus. Now it's time for a flash quiz. What characteristic X-ray finding is seen in a child with croup? And what is the infectious cause of croup? We see the steeple sign on X-ray that is indicative of the narrowing of the larynx or the upper airway. Edema of the paralaryngeal structures causes this narrowing. This is also the reason why we hear the characteristic respiratory stridor in children with croup. The parainfluenza virus, a type of paramyxovirus, is what is responsible for causing this disease. Now we're going to discuss the hepatitis viruses, a very important class of viruses for step 1 in your career. There are 5 different types of hepatitis viruses, named hepatitis A through E. Strictly speaking, these viruses are not one type or family of virus. They are a group of different types of viruses that happen to all cause significant inflammation of the liver, hence the name hepatitis. So let's start with the general things. They're all RNA viruses, except for which one? Hepatitis B virus. Very good. They all cause episodes of fever. They can cause jaundice. They can cause right upper quadrant pain. And they can lead to elevated ALT and AST levels on blood tests. Do you remember what virus family they are all in? How about hepatitis A? Is it picornavirus? Very good. How about hepatitis B? Is hepadnavirus? Very good. And C? Is it flavivirus? Very good. How about hepatitis D? Is it delta virus? Very good. And finally, what about hepatitis E? It is a hepivirus. Very good. The viruses are either transmitted fecal-orally, meaning they are pooped out and contracted orally through food or something, or they're transmitted parenterally, meaning that they are contracted in some way outside of the GI tract, like through an IV, needle, or sexual contact. Hepatitis A and E are the 2 viruses that are transmitted fecal-orally. The other 3, hepatitis B, C, and D, are transmitted parenterally through sexual intercourse, IV drug use, transfusions, or through maternal fetal transfer. The hepatitis A virus is one you can get from fast food restaurants that causes acute flu-like illness, as well as jaundice, and it can cause a watery diarrhea. Acute hepatitis A infection, it is important to know that it is self-limited. It is self-limited, meaning it does not lead to a chronic disease. It is not going to cause chronic hepatitis or hepatocellular carcinoma. In acute hepatitis A infection, the AST and ALT levels are usually in the thousands. They are very, very high. Do you remember what the normal AST and ALT levels are? Between 5 and 40. So in acute hepatitis A infection, you see AST and ALT levels significantly above normal reference values. There is an hepatitis A vaccine, and it is recommended for children, patients with chronic liver disease, and travelers to high-risk countries. Hepatitis E virus is serologically distinct from hepatitis A, but it closely resembles hepatitis A virus in its incubation and clinical presentation. It is also a self-limited disease, but it can cause fulminant hepatitis in pregnant women. Anytime you see a pregnant woman and you think it is hepatitis, you probably should be thinking about the hepatitis E virus. Now let's talk about the other hepatitis viruses, starting with hepatitis C virus. The hepatitis C virus is a flavivirus, and it is primarily acquired through IV drug use or through blood products such as a blood transfusion. Hepatitis C virus is not as easily transmitted sexually, especially compared to hepatitis B. What makes hepatitis C unique is that greater than 50% of patients infected with hepatitis C become or form chronic infections. Chronic infections are serious because they can lead to cirrhosis, liver failure, and hepatocellular carcinoma. We can remember these complications by remembering the 3 C's of hepatitis C infection, which includes chronic, cirrhosis, and carcinoma. Here is a picture of a cirrhotic liver with a nasty hepatocellular carcinoma in a man with long-standing hepatitis C virus. We can see the normal liver parenchyma on this side of the image, and here we can see the nasty hepatocellular carcinoma. Here's an image showing nodular cirrhosis, and it is a very high yield pathologic image where we can see the bridging fibrosis between portal triads and in between the hepatocyte clusters. Here are the hepatocyte clusters, and we can see the bridging fibrosis with a little bit more blue staining significant of fibrotic material. Fortunately, advances in hepatitis C therapy has enabled us to successfully treat a lot of hepatitis C infections. Do we remember the 4 medications that are used to treat hepatitis C? Ribavirin, PEG interferon alpha, Cimeprevir, and finally, Sofosbuvir. Very good. The hepatitis B virus is a more complicated hepatitis virus that is commonly tested on step 1. If you had to know everything about only one of the hepatitis viruses for step 1, I would know hepatitis B. Hepatitis B is the 1 DNA hepatitis virus, and if we remember correctly, hepatitis B is a hepadnavirus, has a partially double-stranded DNA genome, and has a unique and testable replication cycle. After the virus infects the host cell and enters the nucleus, the partially double-stranded DNA is completed into a fully circular double-stranded DNA by cell DNA polymerases. Once the fully circular double-stranded DNA is completed, it is then transcribed into viral messenger RNA. This messenger RNA has 2 key functions. The first function is that it is used to make viral proteins in the endoplasmic reticulum. These proteins are then used to make the complete virin that is then released from the host cell to go infect other cells in the body. Another function of this messenger RNA is to be reversely transcribed back into the partial double-stranded DNA by a reverse transcriptase that is carried by the virus. This partially double-stranded DNA is then recycled and reused to make more mRNA and to make more viral progeny. So to review, you start with the partially double-stranded DNA, which is completed to form the complete double-stranded DNA via the hepatitis B polymerase. Then we make positive single-stranded RNA or messenger RNA using the host cell DNA-dependent RNA polymerase. Then, using the mRNA, we can either make functional viral proteins, or we can use the hepatitis B virus encoded reverse transcriptase, which reversely transcribes this mRNA into the partially double-stranded DNA, which is then used to restart the life cycle of the virus. This is a unique viral life cycle for the hepatitis B virus that I would know for step 1. The hepatitis B virus is transmitted through blood transfusions, sexual contact, the placenta, but most importantly, it is transmitted through this sexual contact. Another unique part about hepatitis B virus is that it is capable of causing both an acute and chronic infection. Infection with the virus usually always results in an acute infection, and as we said earlier, about 10% of the time, it leads to a chronic infection. An acute infection results in jaundice, fever, and increased AST/ALT levels. Most of the time, these infections resolve 90% of the time. However, 10% of the time, these infections can develop into chronic infections that can lead to either an asymptomatic carrier state, or worse, it can progress to cirrhosis and potentially hepatocellular carcinoma. It's important to know for hepatocellular carcinoma is that hepatitis B virus causes carcinoma by integrating into the hepatocyte genome and acting as an oncogene. Finally, hepatitis D virus is a defective virus that requires hepatitis B surface antigen in order to replicate and be infected. Transmission of hepatitis D virus can occur via simultaneous infection with hepatitis B virus, known as co-infection. So hepatitis D virus plus hepatitis B virus is called co-infection when they occur and infect at the exact same time. And then when hepatitis D virus infects a patient who already has been infected by hepatitis B virus, then we get a superinfection. So let me say that again. If hepatitis B virus infects a patient who has already been infected by hepatitis B virus, then it results in what is called a superinfection. The key difference between these two infections is that in co-infection, hepatitis D and hepatitis B virus infect the cell at the same time, while in superinfection, hepatitis D virus infects the cell after it has already been infected with hepatitis B virus.